Hello everyone, welcome to another video. In this video, we are going to do like a CT registry review, what to expect on your CT registry exam. So this is for anyone who has already taken their CT registry course or is just wanting to get into CT and you're trying to just get a head start. But you can use this information pretty much what to expect for the registry. This is with ARRT. I have my license with ARRT, but the information I'm going to give to you, you can use it for any national CT boards. So in this PowerPoint presentation, we're going to just dive in. I'm going to go through the ARRT content specification just to let you all know what to expect for ARRT, but the information is pretty much the same like across the board. No matter where you are, you can use the same material to study for your registry. It may be a little long because I want to just make sure that I'm covering everything in one presentation instead of someone searching 3, 4, 5 different videos trying to get the information. I will put timestamps up so you can just click on whatever section you may need to know. Or I will just put like a link in the description box on the full playlist. So the ART registry has 165 questions. We're going to go through each category and the number of questions that will be under each section. So for patient care is going to be 22 questions. Under safety is going to be 22 questions. For image production, that's your physics, is going to be 50 questions. Under procedures, that's your anatomy, is going to be 71 questions. So if you look, you will see that majority of the tests will come from anatomy questions, and then you also have physics being another major part of the test. So just make sure that you know your procedures and your physics. There will be a total of 165 scored questions, but altogether there will be 195 because you have 30 unscored poly questions, meaning the question they just threw in to see how many people will miss it, get it right, if they want to add it for another registry or in the future. So I will say know every category and focus more on the category that you are the most unfamiliar or weaker in. That's how I did it. I passed all of my registries on the first try, especially CT. So I'm just trying to give you all tips on how to pass on the first try. So now we're going to dive in to each section that will be on your registry, whether this is for ART, this is for a national board. I'm sure it will help and benefit you all. So like I was saying, under patient care, there will be 22 questions. This will fall under patient interactions and management. So we're going to dive into the patient care section. For patient assessment and preparation, you need to know things on patient history, interpersonal communication skills, scheduling, and screening your patients. So, whenever you are screening your patients, if they are coming in for an abdomen scan, are you telling them to stay NPO for at least 4 hours? If they're coming in for a CT head scan, you shouldn't tell the patient to be NPO. And then you also have educating your patient, letting them know what the doctor ordered, how long it's going to take, did they eat or drink if they can't for this exam, are they allergic to iodine, what to do after they have gotten the IV, once the IV is taken out, how to follow up with their water intake to flush out the contrast. So all of this falls under patient education. Patient education, telling them to hold still whenever they are on the CT table because if they move, it's going to cause motion. We get the best images if they hold still. So, all of that is patient education. And then you have your consent forms whenever they have to have a biopsy procedure. They have to sign a consent form. A lot of times, the radiology nurse will handle all of this. You just have to pretty much sit in and just agree whenever you go through the motion. Whenever whenever you are telling the patient, okay, you're in for this procedure. So you have the informed, oral, and implied consent. Know these terms. Know the difference between each one. What is informed consent? What is oral consent? What does it mean when someone is signing an implied consent? Then you have your positioning aids. Oh, the word that I was looking for whenever it came to consent forms was timeout. So whenever you are in a biopsy procedure with the radiologist and the nurse, you go through something that you do like a timeout procedure where the patient go over their name, their date of birth, and they agree what procedure they're coming in for. And then we have the positioning aids. This is going to eliminate motion artifacts and for patient safety. You have your Velcro straps, your padding. You cannot use a sheet or a blanket as far as a positioning aid to help the patient hold still. That is considered a restraint. It didn't come with the company for that machine. That is something you cannot use. You cannot use Coban. So just keep that in mind. Um, Even after your test, just for legal purposes, that's considered a restraint. I know you may see texts or people do that, but you're supposed to use the chin straps and the straps that came with the machine. And then you have your patient monitoring, the level of consciousness, fall prevention, vital signs, heart rhythm, and cardiac cycle, their pulse ox, medical emergency, such as if they are coding, do you know the number for the code team, respiratory team? If you do by chance have a patient in the hospital and they come down as an inpatient or an ER patient and you notice they have their vital machine with them, if you see their pulse at 200 or if you see their pulse rate at 30, do you know that which number is normal or which number is considered abnormal, which category, which range? So just make sure that you know all of your ranges. I forgot to mention at the beginning of the video, I have a full playlist, a full lesson review, a full breakdown of all of this stuff: patient care, patient safety, physics, anatomy. But in this video, we're just pretty much touching up on what you should know for your test. But all of this information regarding each section can be found under my CT Registry / CQR review playlist. Now we have your ergonomics and patient transfer techniques. I hope you all know that whenever you are transferring a patient with a lift or, like a Hoyer lift or a sliding board, I hope you all know that you're supposed to be using at least two people. The more, the better, but you should have at least two people helping you. Make sure that you are paying close attention to patients who have on those fall wristbands and the fall wrist socks, which is yellow in most facilities. Have a nurse or a licensed healthcare provider hold a patient's neck if the patient is in a C-collar. You will see this a lot if you work in a hospital setting, especially in the emergency department. Patients will come in as a trauma patient, they will have on a C-collar. I don't know how you all do it at your facility, but I do travel in radiology, so all the facilities that I have gone to, the patient has been in a C-collar, and we have had to have the nurse, worst case scenario, the doctor come in and help us hold the collar if the nurse is busy. But 9 times out of 10, the doctor never have to come in. The nurse is always available. For your management of accessory medical devices, you have your oxygen delivery system, chest tubes, indwelling catheters. Do you know that the bag's supposed to be kept below the waist level? If not, the urine and the blood can back up into the patient's tubing, causing an infection. Worst case scenario, an infection that cannot be cured and death. Then we have our lab values. Do you know the lab value for your GFR, your creatinine, your bond? What is the normal range? What is considered abnormal? Whenever a CT contrast scan is ordered, what is considered too elevated or what is considered just right? So make sure that you know your ranges. Once again, I have all of this information in the CT Registry review playlist, so you can find like a deep dive into this information in that video or those videos. And then medications and dosage. Are the patient on any type of medication that will hinder their scan. A lot of times, blood pressure medicine, anxiety medicine will not affect a CT scan, even if they have contrast order. I've never asked the patient, or never been told, or never trained, or a doctor never told me to ask the patient if they was on blood pressure medicine before I give them contrast. And then you also have your diabetic patients. That's one thing that you do have to check for if they are a diabetic. So you have to make sure, have they stopped their metformin at the time of the CT scan? They need to withhold it for at least 48 hours after the procedure. Now, I will say, check with your facility, your policy, because I always say when I throw out numbers, medical is always updating and changing. Researches, and a lot of people have researched a lot of things, and each year or each month, a lot of these numbers are updating. So just check with how your facility does things, but you can just know this as well for test purposes. And then for your pre-procedure medications, a lot of the time the nurses will check this. I've never had to ask a patient, like for a biopsy procedure, if they are on steroids, anxiety medicine, blood pressure medicine. I don't have to do that. Like the CT techs where I work at, the nurses normally screen patients and ask them these questions for their biopsies. But you do have to verify that a patient is not allergic to iodine, especially if you're giving them barium contrast. You still need to make sure that they aren't allergic to iodine. You can verbally ask the patient if they are able to answer the patient. A lot of times, if you have like an alter patient, they may not be able to answer you, so you can reach out to like a family member. You can ask the doctor. You can look in the chart. Do not assume that the patient's chart is up to date though and accurate. A lot of times people make mistakes. People forget to add that medical history of the medication, especially the allergies, to the chart. I've had it happen to me several times where I just get in my routine and I still ask if they are allergic, and the patient will say yes, but it wouldn't be in the chart. So don't just assume that the chart is accurate. Now we're going to talk about the contrast media types: ionic, non-ionic, barium sulfate, air, water, water soluble. This is how the breezer bottle look whenever we have like patients who need to drink for abdomen scans, especially if it's with contrast and the doctor wanted to see um, oral contrast and IV contrast for the scan. This is the medicine that you will give them. You have your breezer bottles that we give patients, and then we do add gastrografin in there, 30 milliliters, and then you have your Omnipake. That's what I use whenever I work in CT. Normally we use like 100 milliliter bottle, 75 milliliter. You also have 150, which that's pretty big. A lot of times I don't need that amount, based off the patients that I've scanned. Sometimes I do have to get up to like 125 milliliters or 130. Special contrast consideration. Contraindications will be iodine allergy, kidney failure, low GFR, high creatinine. Always reach out to the radiologist. They will tell you what they suggest, and then you can relay that information to the doctor to let them know, hey, I'm going to change this study. Our radiologist said that, with the kidney function, is this scan can be done without contrast. Sometimes, if the radiologists feel like it is necessary to do with contrast, they will tell you to reduce the dosage. If the patient is on dialysis, make sure they are going to dialysis within the next 24 to 48 hours. And then, if a patient is breastfeeding, just tell them to pump and dump for 24 hours. Pregnant patients can have contrast, although it probably doesn't happen a lot. There are times where I have scanned pregnant patients for a CTPE examination. We just make sure that we do not get the abdomen in there. We just reduce the dosage on the contrast, based off of the doctor and the radiologist preference. But pregnant ladies, I have, and other people have given them contrast. And then you have your non-contrast medication, lidocaine, which is for the biopsy procedures given by the nurse. You have nitroglycerin. This is given by the nurse, given sublingual, which is under the tongue. This is for your CTA, coronary heart scans. It's going to help dilate the arteries in the heart. It does improve your coronary artery evaluation. Administration routes and dose calculations. You have your IV, oral, rectal. The rectal part that I have given, I've given just air. I haven't given any contrast through the rectum and CT, but I have injected air for a CT virtual colonoscopy scan. Then you have your catheters. Keep in mind your central line, your PICC line, your Foley. If you are giving contrast through the PICC line, do you know which line you can use? And then I do have all of this in the patient care video for CT. So all of this is just pretty much review on what you should know. I have the actual numbers, I have the pictures, I have the ranges for blood pressure, vital signs, all in those other videos. So you can feel free to check those out. But for the ones who have seen those videos, this would just be a new video for them, new presentation, new information. So if you are behind on my playlist, just feel free to check them out. But on with the pick line, you will see different colors. You will see purple, red. It will tell you the maximum amount of milliliters you can inject, the rate, and then how fast you're going. And then you also have your venipuncture. Which area can you inject contrast in? If you're doing a CTA, do you know where to go, AC or hand? All CTAs go on the AC or forearm, forearm and up. Do not do it in the hand. It can blow the vein. Mess can get everywhere. It can be infiltration. Do not let anyone bully or talk you into starting an IV in the hand for a CTA, because it cannot be in that area. And then there are a lot of companies where they have a policy in place stating that you cannot go in the hand. So I always just tell someone, I know, but it can't be in the hand. But all your other scans, the with contrast, like your abdomen with contrast, chest with contrast, anything that is not an angio can be, the IV can be started in hand. I also have videos on how to start an IV. I've started IV, so there would be like videos showing me how, or showing you all how I start IVs. Just go to the IV playlist, how to start IVs playlist. I think it may be under venipuncture or IV. And then you have your medical, aseptic, and sterile technique. Do you know that you should be wearing gloves? Do you know when to wash your hands? If it's soiled or dirty, wash your hands with soap and water. You can use your alcohol prep pad for your IV sites, cleaning the hub, the tubing for the IV. Make sure that you do clean the hub. I know it may be times where people do not, but that's a step that is very short. If you don't do it, someone can get an infection. So you also have your documentation. Document the site. Was it in the AC, the hand, the wrist? How much contrast did you give the patient? What gauge size? Was it a 18, 20, 22 gauge? We do not do 24 gauges in CT. If you do, put in the comments, because I do not work in a facility where they do. Although there are certain needles that will let you do like a 24, but I would just say stick to your 18, 20, and 22 gauges. How fast are you injecting the contrast? The number of attempts of how many times you had to start an IV on this patient. Did the patient tolerate the IV well? A lot of times whenever you are documenting, that may be a question that is asked. Now, your injection techniques. Now we're going to talk about safety, manual, power injector options. Are you using a single or a dual head, single phase, multi-phase, especially for your livers, flow rate, timing bolus, bolus tracking? So just know what you will use a timing bolus for, know what you will use a bolus tracking for. Post-procedure care, complications. Did the IV extravasate or infiltrate? Documentation on when to take off the Coban. I always tell patients if they are not on blood thinners, they can remove the IV in 15 minutes. If they are on blood thinners, leave it on for about 30 minutes, no longer than an hour if they are on blood thinners. And then drink plenty of water afterwards, 24 to 48 hours. If the patient do have an infiltration, are you using warm water, cold water? How long are you applying the towel or the towel to the area that did infiltrate? Make sure that you are documenting your infiltrations. Did you reach out to a nurse to let them know their patient infiltrated? If you don't have a nurse assigned to this patient because it's an outpatient, did you document that the patient did have an infiltration? Allergic reactions. Now, you want to make sure that you know all of your adverse reactions, you know your mild, moderate, severe. I do have all this in the playlist already under patient care, so you can go back and refer to that video. It's a full breakdown. Also, recognition and assessment. How did you treat the patient? Who did you call whenever the patient was having an allergic reaction? What was given to the patient? Benadryl, prednisone. If a patient is allergic to contrast, did you know that they can get the scan done with contrast? A lot of times, a facility will have like a 12 to 24-hour prep where the patient take Benadryl, prednisone, stuff like that. You just have to follow your company's policy. If they give Benadryl every 2 to 4 hours, if the patient have to take a steroid every 4 to 6 hours, all of that is in the protocol. But patients who are allergic to iodine, if it is important and the radiologist and the doctor see fit for them to have the contrast, then they can be medicated for it. It's called pre-medication. So now for your infection control, cleaning the equipment, making sure that you're using disinfectant wipes, when to use bleach wipes, changing the sheets, paper on the table, wiping down the equipment, placing needles in the sharps container, placing the linen with the blood on it in the correct container, the red bin. How long do you have to wash your hands for? Also know that information. So we're done with patient care. Now we're going to talk about safety. So for the safety, it will be 22 questions. We're going to talk about radiation, safety, and dose. So this is the part of the physics. So some physics you will know or need to know for this section. A lot of this physics is coming from your X-ray physics that you've learned, your characteristics, your Compton, photoelectric, coherent, your attenuation by various tissues, acquisition, your inverse square law. A lot of this you will know from your X-ray boards or your X-ray school. Minimizing patient exposure. Do you know your ranges for KVP, mass, pitch, collimation, beam width, filtration, gating, image reconstruction, detector efficiency, your dose notification, dose alert? Whenever you do get the dose alert, what is it telling you? Is it telling you that the patient dosage will increase because you increase the mass? So that is stuff that you have to know, especially if you're working as a tech, which is very important. For radiation protection, are you shielding your patients? A lot of companies have changed their protocol where you no longer have to shield patients, but I always give shielding to patients, especially, of course, if they're pregnant, you have your kids. If a patient is in the room and a family member want to stay in the room, you give them the lead apron and the thyroid shielding. Patient consideration, positioning. If a patient is having a lot of pain, do you know to put the cushion under their legs to help take pressure off their back? If they have neck pain, build up their neck if you can, with like a little towel, little sponge, nothing that's going to elevate them up too high, but it will be hard for them to hold still for that minute to 3 minutes if you're scanning their neck and their neck isn't raised appropriately. And then make sure the patient knows to remove all metal objects, belts, cell phones, take out the jewelry, bobby pins, hair clips. Communicate with your patients. If they speak a different language, change the language to the language that the patient speaks the best. For your pediatric patients, try to make it fun for them, because some pediatrics are or like nervous about the scan, but some is very brave. But just try to make it fun. Tell them it's a big camera. Make sure you smile big, especially if you don't work at a pediatric hospital. So I do not work at a pediatric hospital, but there are times where PDs come in the hospital I work at. So at the in the city that I live in, they have two pediatric main hospitals, and then they have a lot of pediatric clinics. So a lot of times the main hospitals, pediatrics do not come there. If they do, it's probably because the wait list was long at another pediatric place. So when you do have a pediatric protocol in place, whenever you are scanning those patients, make sure that you are changing it from adult patient to pediatric patient. For your adults, especially whenever you are giving contrast, what is their weight? Whenever you are giving them contrast for abdomen scans, do you know how to calculate their weight? A lot of time, the injector will have it to where you can put the patient's weight in there, and it will tell you how much contrast they recommend that you give the patient. And then you have your pregnancy patients. Your dose measurements, know your units for absorbed dose. Do you know that that is rad? Effective dose, millisievert, know the definition, know what CT dose index is, know dose length product. Make sure you know the difference between these two. It is easy to get CT dose index and dose length product confused. Personnel protection, if you have a COVID patient, TB patient, hepatitis, flu virus patient, what type of PPE are you using for these patients? Make sure that you control your area if you are scanning a patient. Make sure your door is closed. Make sure no one just randomly walking in the room getting radiation for no reason. So we're done with that section. Now we're going to dive into the image production. 50 questions will be under this section. We're going to talk about image formation, 28 questions under this section. Image evaluation, 22 questions. So this is going to be your physics, which will be the second largest part of the test. We have image formation. This is the components of your CT unit, your gantry, your tube, X-ray production. When do you warm up the procedure? Do you know that a lot of times when the CT tube get cold, it asks you to warm it up? You don't want to have to warm this up when a patient is on the table, you're in the middle of the scan, because the patient may get nervous. How often do you perform your daily QA? How often is your QC performed? Do you know your generators, your detectors? Also, make sure you know your generations, first generation, second generation, third generation. Know your slip rings, data acquisition system, your array processor, and host computer. What do you send your images to? Do you know that's called PACS? Imaging parameters. Know these terms and definitions. Know the ranges like KVP. Do you know the range can be 100, 120, 140? Do you know which mass is too much for the exam you're doing? Pitch. That's how fast the tape is going. Collimation. Beam width. Acquisition slice thickness. Which direction is your X, Y, and Z planes on the scanner? Your scan field of view. Your methods of data acquisition, your axial, your helical scanning. You know, axial scanning is whenever you tilt the table for a brain scan and you're angling it and you're tilting the table and it's telling you to hold down that button to tilt it. So that's axial. Helical scanning is whenever you don't have a tilt on it, you just scanning a patient, it's going to scan them quicker than the axial. And then you have your volumetric, your shuttle, continuous cine, your dual energy, dual source. Image reconstruction, make sure you know the terms, the definition for all of these. Post-processing, do you know how to MIP? Do you know what MPR stand for? 3D rendering, do you know how a MIP or a 3D image look? Calcium scoring, do you know the calcium scoring range? Do you know how to score for a calcium score? So let me all know in the comment box if you perform like a lot of calcium scoring. Calcium scoring is easy to do, especially just doing the scan. So I know a lot of times people don't get certain experiences. Let me know if you perform biopsies, if you do calcium scoring. Then this is your coronary calcium test scores. These are the ranges. 0 for no calcium is detected. You have mildly increased risk of heart disease for 1 to 100. If someone was given a score of 101 to 299, moderately increased risk of heart disease. 300 and on, 300 on up, moderately to severely increased risk of heart disease. So whenever these patients come in, we do tell them do not drink caffeine because it can make their heart rate go up. And then we do hook them up to like something similar to EKG leads. It's going to monitor their heart rhythm. So if it's above a certain number, reach out to the radiologist or tell the patient. So first, see if the patient can get their heart rate down. A lot of times I tell the patient, take in a breath, blow it out, and I tell them to do it again, and it does help their heart rate, go at a normal range. If it's elevated, you've done all you can. If it's like 160, reach out to the radiologist to see if the patient should reschedule or not. Now we are talking about more physics, your pixels, your voxel, your matrix. Do you know the definition of those? Do you know your window level, your window width ranges for bone, lungs, soft tissue, abdomen, things like that? Know your image quality. I have a video in my playlist about this. Someone requested it, so I made the video. At the time when I first started making YouTube videos, a lot of people, the algorithm, I guess, wasn't pushing out my videos. So a lot of people have found my videos late and they have been watching it. They find it to be helpful. So I did get like video requests on, can you make more physics videos? So I have a full video in my playlist on spatial resolution, contrast resolution, temporal resolution, know your Hounsfield units, know the definition for these terms. What is spatial resolution? This is the ability of the imaging system to distinguish between two closely spaced objects or structures, essentially defining the level of detail visible in the image. So when you think of spatial resolution, think of something so finely that you're trying to visualize. What is contrast resolution? The ability of the scanner to distinguish between objects with slight differences in tissue density, contrast resolution. Think of whenever you give patients contrast for abdomen scans or contrast for CT for any CT scans. So I will say spatial resolution and contrast resolution is sometimes that those vocabulary terms, it could be hard for people to grasp, but know the terms is very important. Know those terms. This is just a picture you can just use as a guide on how and when to visualize spatial resolution. How does it look whenever it is high, when it is low? So that's good for you. Artifacts, I have a video on this. Actually, I think it's labeled CT Registry Review artifacts or something. You can find all of these videos in my CT Registry Review playlist. I think you will find them very helpful. I dive in deep on what is motion artifact, edge gradient artifact, how does it look on the image. Know your equipment artifacts such as rings, streaks, tube arcing, cone beam. Know how to send your images. Like, where does it start with? It starts with the patient, which is the subject to scan, all the way to the X-ray or the CT scanner, the CT detector. Then you have your image reconstruction from the CT images. That is going to give you that full image of the axial, the coronal, the sagittal. All right, y'all, we are getting through this. Now we're going to talk about the procedures. If you have any questions, you can feel free to leave them in the comment box. You can give the video a thumbs up if you found it to be helpful. So for procedures, this is going to be the bulk of the test, 71 questions. We're going to talk about head, spine, your MSK, which is 25 questions, neck and chest, 21 questions, abdomen and pelvis, 25 questions. Okay, so for the anatomy, like I was saying, it's going to be the largest portion of the exam, 71 questions under the anatomy category. So click on my CT CQR registry review playlist. It's going to give you a full breakdown on the anatomy. I also have review questions and answers. Know how to identify the anatomy. Know the functions of the anatomy. What is the function of the liver, kidney, spleen, gallbladder? Can you identify the pituitary gland? What is the purpose of the pituitary gland? I would suggest when it comes to anatomy, make sure, especially the larger anatomy structures, make sure you know those, like your pancreas, spleen, liver. Um, know how to pick out those larger ones. And then whenever you got those larger ones down, go to the small ones like your arteries, your aorta, your descending aorta, things like that, your common carotid artery. Know your lobes, frontal lobe, temporal lobe, occipital lobe, parietal lobe. Know how to identify this whenever you do see it on the image. It is also good to know the function. Cross-sectional anatomy. If you were to look at an image, can you tell the difference between an axial, coronal, or sagittal image? Your landmarks. The abdominal aorta, which bifurcates into the right and common iliac arteries, is located at approximately the level of L4. The celiac trunk is a very short vessel. It divides into the left gastric artery, common hepatic artery, and splenic artery. Very, very important to know your arteries. Know them, please. And then this is another picture that you can study. I will say, know this information, know how to pick it out, know which area it branches off to or from. How many cranial nerves do we have? Do you know that it's 12? Which number corresponds to which one? You can also know the functions of the cranial nerve. It's good to know, just to give you an idea. I have them numbered, and then I have them continued on this page if you all would like to just read up on the cranial nerve. And then your head and neck arteries, your circle of Willis. This is your circle of Willis. This scan is normally ordered, especially in the emergency section or department. If a patient is coming in having a stroke or stroke-like symptoms, a CTA, head and neck will be ordered. Sometimes even a perfusion scan is ordered. So know your arteries in your head and neck. The carotid arteries branch out from the common carotid artery at the level of the fourth cervical vertebrae, C4. This is also known as the carotid bifurcation. The common carotid artery splits into the internal and external carotid or carotid arteries at this location. So make sure you know your arteries. If you see an image, know how to label it or pick it out, know which one branches off on which side. For your anatomy questions, you could be asked about one of these: anatomy and physiology, which is cross-sectional anatomy, pathology considerations, landmarks, your vasculature, For your factors, imaging planes, protocol consideration, patient consideration. Are you scanning a pediatric patient under the right protocol? Do you have a protocol in place for bariatric protocols? For your geriatric patients, make sure they do not fall off the table. Use your safety belt, your seat belt. Post-processing presentation, how to MIP, NPR, when to do your 3D rendering. You have your contrast media, indications for it. If a patient has infection, cancer, that's going to be a lot of times where the scan will be ordered with contrast if they aren't allergic or if they don't have any kidney problems. For your scan prep delay, for your abdomens, did you see anything on the liver? Did you see anything on the kidney? Did you do a 5-minute delay? When should you do a 10-minute delay? Also for your PE scans, do you know where to smart prep? Additional procedures, we have our CTA, CTV, your runoffs, your PE, venogram, biopsies, drainages, aspirations, trauma. Put in the comment box if you perform biopsies at your facility. Know your heart anatomy. Know where it starts as far as enters through the superior vena cava or inferior vena cava. Where does it go? Does it go to the right atrium, right ventricle? Things like that. Just know your heart anatomy, especially how to identify it on your CT images. Identify and know these other anatomies for your head, your temporal bones, orbits, sinuses, your mandible, brain perfusion. Also know your spines. Whenever a patient come in for a myelogram, a lot of times we do have them rolled from their, and of course the bed is parked super close to the table and the bed is locked. So the patient will need to roll from their bed onto their stomach and then they roll again like a 360. This is just to let the contrast go evenly through their spinal canal. Know your MSK, your upper extremity, lower extremity, your pelvis, hips, shoulder. If you were to see this picture on the on your test or whatever, even if you're working as a tech, what procedure do you think was performed? Do you think it was a CT shoulder without contrast or a CT chest without contrast, CT orthogram? You should know that this is an orthogram of the shoulder because you see contrast coming from the joints or around the joints. So this would not be a regular CT shoulder with and without contrast. It's considered a shoulder orthogram or an orthogram of the shoulder. For your other anatomy, know your anatomy under your neck, chest, abdomen, pelvis. For your low dose lung screening, do you know why this is performed? A lot of times you have this performed on patients who have smoked for a long time, smoked cigarettes. So they do get the low dose lung screening just to make sure they don't have any lung cancer or a spot on their lung. Do you know your common hepatic duct, common bile duct? When does it branches off? What is the function of your liver and your gallbladder? All right, so now let's say you've made it through your study review, your questions, and your study guides. So now it is time for your test. So how do you feel during your exam? For this section, we're going to talk briefly about the fees, exam prep, test date, and your results. For your CT registry, and this is with ARRT, this part. So if you don't have ARRT, you can still use these review videos to help you pass your boards. I've had people who have been from other countries who have used my registry review lessons and passed. But specifically, this part is going to be catered to ART because it's about their exam fees and what they require for you to sit as a CT tech. So for the registry exam, It's going to cost about $225. And I say about because this is for the year of 2025. So who knows in 2026 or 2030 if it's going to go up or not. You also have your clinical requirements. Did you meet all of your clinical requirements? Which is a minimum of 125 repetitions. A maximum of 9 repetitions may be logged for each day. And then you also have your continuing education courses. Did you complete at least 16 hours of your CEUs? This is only if you did one of those self-study courses where you go online and you pay for a bundle and you get anywhere from like 16 to 20 CEUs. If you have gone through a college course and program, you don't have to worry about that because they have the continuing education hours and credits already built into their program. Do not reschedule your exam. This is very important. A lot of people schedule their exam and then they reschedule it. And I've seen a lot of people didn't pass on the first try because they got nervous and they rescheduled. So when they did go in and take their test, it made them more nervous. So I'm not saying that everyone who reschedules fail. I know sometimes things come up to where you book the date, something happened, you just have to change it. But I'm just saying, like, if you're changing it because you're nervous, don't reschedule. So now I'm going to just give you a quick rundown of what I did to pass. I studied from 2 review books. I read the entire books front to back at least 5 to 10 times until I knew the information. If I was to see part of the sentence in the textbook, I was able to finish the rest of the sentence without looking. That's how much I knew the information. I did review questions and answers and explanation that was in the textbooks that I had bought and online. I studied over 3,000 review questions and answers because the books that I had, it did come with questions in the book and it came with a CD or like a code for me to have access to questions online from that same book. I will suggest at least 2 books. I believe that it gives you like a wide range of material and questions and answers where no matter how you are asked on your test, you can still pass because you have these questions and answers to help prepare you. I studied throughout the entire CT program, so I didn't have to study long for my CT registry. I actually took my test 1 week after I finished the program because for X-ray, it took me 3 months, and I said I did not want to take that long to study for a registry again because I didn't want to forget. So for CT, pretty much took it right after I was done with my program. I do not recommend going longer than 3 months whenever you are studying. 1 to 3 months is like the sweet spot because if you do go past 3 months, you probably will forget some of the information. A lot of people ask me what review books did I use if I can recommend a good review book. I cannot. I'm sorry. I cannot recommend a review book. And I say this because I had someone who gave me a list of books that they use. I bought it. I wasted money and time because it did not help me at all. The information was not even close to being similar to what was asked on my registry. So let's just say if I would just study exactly what they studied, would have failed. Sometimes what worked for one person may not work for another person. Even with my MRI registry, people was studying from a certain website. That website did not help me out at all. Although they had the material laid out and it helped some people, it didn't help me. I used other review books. So I do not want anyone, saying that I suggested the wrong book. So a lot of times I just let people just Google their own review book. I will say you can go by how many reviews, how many 5 stars a review book have to help you make your decision. But I just don't want to be the person where someone say, you told me to go out and get this book and it didn't help me. So I just let you all choose what review books that you want to choose. But I did use 2. So I do have several review lessons, questions, answers, explanation, anatomy on my in my playlist for CT. You can use it after, during, before your CT program. It probably will help you speed up things and know the information better or quicker. But I do have like a few review lessons laid out for you all already. And then I will say break down the material into sections so that you can learn it better. If you are the ones who is struggling with your physics and sectional anatomy, that's going to be the largest part of the exam, so you may want to focus on that the most. But I will say just taking one step at a time, taking one day at a time. Start with your physics if you are not strong in that area. Do not forget about patient care, though. A lot of people think patient care is the easiest part of the exam, but it can be the hardest if you don't study. So these are things that I suggest you do not do before your test date. Do not study no more than 3 months. Do not reschedule your exam, because I know some people who have rescheduled and they did not pass due to anxiety. Do not tell everyone you are taking your exam. I know you are excited that you are getting ready to take your CT exam. It's going to be another modality under your belt. But I will tell you, some people will probably be sitting by their phone waiting to see if you pass or not. That's going to cause more anxiety. At least if you take the test and you fail, you don't have to tell anyone. If you take the test and you fail, you told everyone that you're scheduled to take your test on May the 30th. Now everyone is going to be waiting by their phone, looking on the internet, scrolling to see if you passed or not. Do not study, only review questions and answers. I've had people where they told me that they only studied the review questions and answers and they didn't pass. You're not going to pass that way. You have to know the information. You have to understand it as well. Do not study the night before your test. You should already know this information. So if you are studying the night before your test, it shouldn't be studying. You should just be reviewing last minute notes just to make sure that, hey, if I do see this on this test, I can get it. I can answer it. So before your test date, this is what you do want to do. You want to get a good night rest, have all required documents on your table, ready to go in your purse, in your wallet, in your bag, because they will ID you. They will ask for your ID. I brought my social security card because it has like my signature on there. I think they want two proofs of IDs. So I gave them my ID and social security card. And then you can also, if you want to just make sure you don't have to reschedule, you don't have to go back and get more information, bring your ID, bring your debit card, bring another third proof of something where it can show, hey, I am who I say I am. Make sure that you do set your alarm clock, and arrive early. You don't want to be rushing to get there on the day of your test. It's going to increase your anxiety. Make sure that you have reviewed everything before your test date. You should not be reviewing anything the day of. On your test day, eat a good breakfast. I normally drink a soda on the day that I have to take a test. And I say on the day I have to take a test because I've taken 5 different ARRT tests. I've taken one for X-ray, CT, MRI, mammography, and breast ultrasound. So I did take 5 different registries. Bring your ID card, social security card, debit card. Turn your phone off. You can leave it in your car. I do not trust putting it on do not disturb, because a lot of people know that if you have an iPhone, if you put it on do not disturb, if someone call you back to back, so if they call you the first time, they can't get through. But if they call you the second time, they can get through and it's going to ring. And they will probably tell you your test has been forfeited because the sound has disturbed someone, or you left out of your chair from taking your test and looked at your phone. They can think that you are cheating, which I bring up. Do not cheat or attempt to cheat on your test. It's not worth it. um, Make sure you know the information. Give yourself plenty of days, weeks, even months to study. do not cheat. It may just take away your ART certification, even for X-ray. A lot of people who are taking their CT certification already have an X-ray license. Most people probably is even a nuclear medicine tech. Before you get out your chair, whether it's to use the restroom or to say that you're done, make sure that you do raise your hand because they probably will get rid of your test if they feel like you're getting up, if you're looking around, if you're cheating. If you wear glasses, they will have you take off your glasses and put it on like some type of tray, and you have to spin your glasses around. They want to make sure you don't have a camera in your glasses, so do not bring pens. Do not try to bring your Apple Watch or anything because they will have you to remove it, or a Samsung watch. And once again, if you don't know the information, you don't know it. It's not worth cheating to pass because you're going to get caught. It's not worth it. I will say, whenever you do select an answer on the test, don't change it. Just leave it like that because if you go back and change it, you may change too many correct answers into wrong answers and end up failing. So a lot of the preparation you do have to do, you all may remember this from your x-ray test or another test that you took where you had to bring all of this ID in, lock it up. This is probably a lot of stuff that you do know, but just a reminder of what not to do for your results. So whenever you do finish your test, you're going to get your preliminary results. This is just going to say, hey, we scored you. This is your results. But of course, it's going to go through the ARRT. They're going to do the final check. Especially if you failed or close to failing. They're going to make sure that they didn't make a mistake, or you didn't make a mistake, or somebody didn't make a mistake. Make sure you remember to close out of all of the browsers on that screen to make sure that your information and answer saves. And then, so I put this little note in because we're not going to talk about you fail or what happens if you fail, because I know everyone is going to pass this test on the first try. I've already gotten comments in my under my videos of they passing their mammography registry on the first try, because I do have mammo registry review videos. So I know you all going to pass on the first try, so we're not going to even talk about what happens if you fail, how many attempts you get. We're not going to even discuss that. So your results will be mailed to you. And once again, congratulations for passing your CT registry. I know you all will get it on the first try if you do the right thing, read your book, look at my review videos, do the steps that I tell you to do. You will pass on the first try. So that's it for this video. If you made it this far, I hope I gave you everything that you need to pass your registry on the first try. Once again, check out my playlist for CT registry review. And I do have lessons, review questions, answers, explanations. If you found this video to be helpful for you, please give it a thumbs up. You can also subscribe if you want to see more videos from me. You can put in video requests. If you need help, you can put in, hey, can you make a video on this section? Can you make a video on another topic? And I will read it and just give the video a thumbs up if you don't mind, because it just motivates me to make more of these videos to help you all study and pass on the first try. But if you have any questions, you can leave them in the comment box if I didn't answer it. Also, make sure that you check the description box that I have under all of my videos. A lot of times, if I forget to mention something in the video, I do mention it in the description box. Sometimes I ask you questions, just for fun, just to get an idea of where you all at in your review lesson. Like, are you weak or strong at this course or this category? Do you perform these type of biopsies? Do your clinic do these type of scans? And then also someone else in the comment box can learn from it as well. But other than that, that's it for this video. I hope you all enjoyed it. I really will or would appreciate if you gave it a thumbs up. It took a lot of time to make this, y'all, because I'm in school. I always say this, so I always say I'm in school, so it does take a long time for me to put together these presentations because I want you all to pass. You know, I passed all of mine on the first try. I want everyone to pass. I don't like hearing whenever I work with certain people, they say they passed. Oh no, they say they failed at registry. So anyway, giving a video a thumbs up, it supports my channel. It lets me know that I've helped someone. So, but that's it for this video. I hope I gave you all the information that you need to pass, as well as my CT Registry review playlist. Bye. I will see y'all in the next video.